Hello. This talk is about sarcoma survivorship. We have developed a new type of clinic visit at Fred Hutchinson Cancer Center. This is a disease-specific survivorship visit dedicated to our sarcoma patients. First, we will start with some definitions. Who is a cancer survivor and what is cancer survivorship? The American Cancer Society defines a cancer survivor as anyone who has ever been diagnosed with cancer, no matter where they are in the course of their disease. What is survivorship? The National Cancer Institute has this definition. Survivorship focuses on the health and well-being of a person with cancer from the time of diagnosis until the end of life. This includes the physical, mental, emotional, social, and financial effects of cancer that begin at diagnosis and continue through treatment and beyond. Where does survivorship fit into the sarcoma journey? The sarcoma patient's experience could be divided up into 3 phases. First, the diagnosis phase, when you might undergo scans and a biopsy to arrive at the diagnosis of sarcoma. Once a diagnosis has been made, you would enter a treatment phase. This would include treatments such as chemotherapy, radiation therapy, and surgery, sometimes all 3. After treatment is done, you would enter a follow-up phase, or sometimes we call this the surveillance phase. This is when you would be coming back to clinic for regularly scheduled scans and exams to monitor for recurrence or monitoring for spread of the disease. A survivorship visit would usually be recommended between 1 to 2 years after the end of treatment. It could be any time after treatment ends. These are the things that we will talk about in this talk. What is sarcoma survivorship? What occurs during a survivorship visit? What happens after a survivorship visit? How to request a survivorship visit at Fred Hutchinson Cancer Center, and where you could learn more about survivorship. The first question, what is sarcoma survivorship? Survivorship includes recovering from your sarcoma treatment, supporting your health after sarcoma treatment, and helping you to return to your physical activities or sometimes new physical activities after treatment. Also learning about possible late effects of sarcoma treatment. What occurs during a survivorship visit? A survivorship visit is a 1-hour visit with your team APP. This person would already be familiar to you. This is your nurse practitioner or your PA, or the person you are normally seeing for your follow-up scans and exams. We usually do a survivorship visit with telehealth, but it could also be in person if you prefer. We would discuss any topics you wish, and I have some examples of those on a later slide. We will review your treatment summary and care plan. I will also explain what those are on the next slide. What is a treatment summary? The treatment summary is, the example of that is here on this slide. This is prepared by the survivorship nurse at Fred Hutchinson Cancer Center. Her name is Deb Loaker, and she prepares all the treatment summaries and care plans. The treatment summary includes the patient's general information at the top, all the team members on the care team. This would be your surgeon, your medical oncologist, and your radiation oncologist. We also like to include your primary care physician and their contact number and information on that part of the treatment summary. The next part is where we would include your cancer diagnosis information, your oncology history. This includes your biopsy, how you presented with your symptoms that led to the diagnosis. After the diagnosis, the treatment portion of the treatment summary, which includes any chemotherapy that you had, radiation dates and doses, and surgical dates. Also, it would include any complications or delays in your treatment. So after the treatment summary, we go over the care plan, and this includes your surveillance protocol, the scans and visits, and how often you need to be seen. It would also outline possible late effects of your treatment and what to watch out for. It includes recommendations to manage long-term symptoms of your treatment and recommendations that can guide your primary care provider or family doctor. This example shows an outline of the long-term effects, and we usually tailor this to your treatment and things that you specifically could be looking out for. And also it includes ways to manage or minimize the potential late effects of your treatment. Other topics that we would discuss during your visit, this would be totally up to the patient. We can discuss long-term effects of treatment. A lot of times we discuss fear of recurrence and uncertainty. We can discuss exercise, nutrition, sexuality and intimacy concerns after cancer treatment and after cancer diagnosis. Memory and concentration can be important topics to discuss, especially after chemotherapy. And we do have resources available for all of these topics. What happens after a survivorship visit? You would receive a copy of your treatment summary and care plan. This would come to you in the mail after your visit, along with a survivorship notebook. We'll talk about the survivorship notebook in another slide. Your treatment summary and care plan would also be shared with your local provider, and you would also be offered an optional nutrition consultation, and we will talk about that in another slide. The survivorship notebook. This is an example of the table of contents of the survivorship notebook. It contains information about cancer survivorship in general. There are resources for survivor topics such as fear of recurrence, healthy diet recommendations, physical activity recommendations, and stress management. What is a nutrition consultation for survivorship? The Fred Hutch has a survivorship nutrition program, and you would be able to have a consultation with one of our dietitians. Usually this person is Paula, and her photo is there. She can discuss sarcoma-specific diet and nutrition recommendations, including long-term impacts of treatment and managing those long-term impacts with diet and nutrition. She can also recommend a plan for weight management if that is what you're looking for. So how can you request a sarcoma survivorship visit at Fred Hutchinson Cancer Center? Fred Hutch patients can just call our scheduling coordinators at the clinic line, 606-2018, or you can send a message to your sarcoma team through your MyChart. If you're not a Fred Hutch patient, but are interested in a sarcoma survivorship visit, you can call our intake coordinators at this same phone number, 206-606-2018, and just let them know you're a new patient and that you're interested in a sarcoma survivorship visit. To learn more about survivorship, I will be showing you some slides that can take you to areas in the Fred Hutch website where you can learn more. This QR code will take you to the Fred Hutch Survivorship Clinic webpage. There's a lot of information and resources about survivorship on this page. If you are a sarcoma patient and you'd like to learn more about our surveillance and survivorship clinic visits, you can go to our website through this QR code. The Nutrition Services website is here, and you can watch some other videos from the nutrition providers and learn more about what they offer with the nutrition consultations. Thank you.